More than 14,500 in Singapore have applied for early COVID-19 jabs since sign-ups began last month. So far, the Health Ministry has allowed a quarter to go ahead, mostly those travelling for work or study in countries like China, the US and the UK. Those with earlier travel dates also got to move up the queue. Meantime, healthcare providers say more are going for antibody testing as part of China travel requirements. Sherlyn Sia with the story.
This lab is looking for antibodies in blood that are created when a person is struck by the COVID-19 virus. Many clinics offer such serological tests in Singapore at around $30, with results out in half a day. Demand has gone up, especially from those heading to China, where they'll need to show a negative antibody result as proof of no past infections. So far, Parkway Labs has processed 40,000 such samples since last June.
It's increased gradually as the borders are starting to slowly open to certain countries. Certainly we can accommodate the increased capacity, but it really is a determinant of how fast and how wide the borders open and whether other countries also will add the same requirement to have an antibody test.
Such tests may also be used to see if a person is immunized sufficiently from vaccines, since these may also create antibodies in people. But Dr. Tan cautions that it's a blunt tool, since different vaccines will cause different antibodies to form, and tests will have to play catch-up.
Each vaccine developer has targeted a certain component of the coronavirus. Hence, when the person who has been vaccinated against using this particular vaccine will develop an antibody that's specific to that particular component of the coronavirus. So the serology test cannot be applied to every single vaccine.
At least one expert says antibody tests for those vaccinated may not give the full picture.
The test cannot really tell you whether you're truly immune or not, because we don't know what actually gives rise to immunity. Whether it's antibody, whether it's T cells, whether it's both. What are you going to do to that person who tests negative on your test? Are you going to give them a third shot? Where is the justification for that? Where is the safety data for that? It gets into very, very murky grounds.
Besides Parkway, Thomson Medical also started offering these tests for those travelling 2 months ago and can conduct up to 200 a day. The Health Ministry has said it'll not test people who've received COVID-19 jabs, but it'll carry out further studies in select groups of vaccinated people to monitor the persistence of antibodies in them.